Well, good afternoon, and thank you for attending our webinar. My name is George Knapp, and I co-manage the CDAPP Suite Success Resource and Training Center, along with Cynthia Pena, who's online with us today. The purpose of this webinar is to let our affiliates and constituency know about the recent changes to the California Diabetes and Pregnancy Program. As many of you are aware, the CDAPP regional offices are no longer being funded and closed on June 30th. Although the regional offices are closed, the program and many of its elements are still in place and will continue. Today's webinar will feature some of those services. You will notice a session menu where you enter questions on your screen. So feel free to use this feature during the presentation, and Cynthia and I will try to answer as many of these questions as time permits at the end of the webinar. For those we can't get to, we have your name and list of your emails. We'll be able to email your answer to you, and we'll do that. Also, at the end of today's presentation, Cynthia has a giveaway to One Lucky Winner, so stay tuned and she'll tell you about that at the end of the webinar. Our agenda today will feature a few highlights regarding the history of CDAPP Suite Success. In addition, I will provide a brief statement of missions and goals for the affiliates as well as that of the Resource Center. Please note that I cannot field questions that are clinical in nature, as that is beyond the scope of my practice and that of this webinar. CDAPP began in 1982 as a pilot project in San Francisco and was funded by the March of Dimes. The CDAPP region programs were established to assist new affiliate clinics, set up and train staff to deliver quality diabetes and pregnancy care with proven outcomes. The regional offices comprised of a multidisciplinary team which included a diabetes nurse educator, a registered dietitian, and a behavioral medicine specialist, that along with their medical director. As you can see on the map, these were established throughout the state. Prior to CDAPP, patients with diabetes and pregnancy really received minimal intervention. Today, care for pregnant women with diabetes is more widely available across the state, and most care providers now have similar teams in place with their healthcare network. These care programs are well understood and can be replicated without public health assistance. Success of the regional offices in assisting the affiliate clinics with their mission is exemplified by the fact that in 2011, over 200 Suite Success affiliate clinics in California delivered care to more than 21,000 pregnant women. In acknowledgement of that, today we had 228 people register, well over 120 that have already signed in at the moment. And they come from 6 different states, 4 federal government agencies, 2 U.S. military branches of service, 4 insurers and payers of care, 5 private national corporations, and over 100 affiliates here in California. So we're very excited about that. Not to forget those that came before us, although this small collage in no way is the totality of those who participated and supported this program over the last 30 years. These are a few of the faces that you might have met, and let's extend them a thank you or a round of applause next time you see them. The mission of CDAPP Suite Success is to optimize maternal and fetal outcomes through the promotion of best practices of care for women with diabetes. This care occurs before, during, and after pregnancy and includes health education promotion along with disease prevention and treatment. Care is delivered using a multidisciplinary team, which includes, like I said, the diabetes nurse educator, the dietitian, and the behavioral medicine specialist, those in conjunction with an obstetrician or appropriate care provider, utilizing CDAPP Suite Success guidelines for care. And we'll review those. Program goals refer to how affiliates carry out the management of pregnant women who have developed diabetes during their pregnancy. This is accomplished through the promotion of quality medical management and, of course, psychosocial and nutritional interventions, along with proper exercise recommendations, which, as I noted in the previous slide, are included in the guidelines for care. Additionally, in order to prevent the recurrence of gestational diabetes with future pregnancies, or the development of diabetes after pregnancy, it is necessary to promote healthy lifestyle changes during prenatal and interconception care. Outcomes should match those of women in the general population with respect to intrauterine growth patterns, birth defects, and morbidity and mortality of both the mother and the infant. The Resource Center is your resource for materials and information necessary to meet the requirements for affiliation as a CDAPP Suite Success provider. Let's look at the components that make up the affiliation, which are education, provider and patient materials, the Memorandum of Understanding, the online annual site survey, and then we'll take a quick peek at our website. Over the course of the next 12 months, the Resource Center will provide 6 convenient one-hour affiliate training webinars. These are intended to help existing affiliates keep current in their practice. Expert speakers will provide lectures very similar to those that you attended in your regional affiliate training workshops. The requirements to maintain existing affiliate status will have to be, we'll have all the staff attend 4 hours of annual training, which can be done through the webinars. Those training, when attended live, will provide free CEUs to those nurses and registered dietitians. As for those who cannot attend, we will make those available through a link on our website. So these sessions will be recorded and you'll be able to watch them. For those wanting to become a new affiliate, there's an application process that we will be addressing in a future webinar after the first of the year. Here you can see a list of the possible topics for the future webinars. These are consistent with the topics of the affiliate training workshops that your regional CDAPP offices hosted in the past. Of course, as the needs of affiliates arise, we will work to accommodate those. Materials for clinicians and providers will continue to be available. Most of these are or will be available as a downloadable PDF file free from our website. Additionally, the Resource Center will continue to provide printed material as they have done in the past. The Guidelines for Care, a large 10-chapter volume, has been revised and is making its way through the state approval process. Once this work has been released for distribution, we will send out an email notice to everyone on our distribution list, which includes, of course, everybody in attendance today. For those who desire a printed copy, these will be available at a reasonable printing cost. The updated guidelines for the diagnosis of hyperglycemia were introduced about a year ago and were developed by CDAPP staff. These guidelines are influenced by the ADA, the IADP study group, and the HAPO study. This algorithm will assist healthcare providers with early recognition of women with gestational diabetes or unrecognized type 2 diabetes. The MyPlate for gestational diabetes has replaced the food pyramid. This product became available in April of this year. And as you look at the front side, I'll flip and let you look at the back. As with all of our materials, we look forward to feedback regarding performance and design. So feel free to send your comments to us via email or fax or written letter if you want. We also do field testing, so often when we design a new product, we send that out to affiliates and get feedback on them and then work on the design and performance issues. Looks like we're still getting responses, so I'm going to move to the next slide and then allow Cynthia to give us the results. Materials can be ordered via our website, by email, or by faxing a request to our office. Of course, the simplest way is just send us an email. We've worked with many of you over the years and have a system in place knowing how to take care of that with you. A copy of our catalog can be downloaded from our website, and we'll see that in a moment. Cynthia.
Okay, so 41% of you are currently using the 75 gram, 32 are not, and 26 aren't sure.
Great. Maybe they weren't aware of the new diagnostic criteria from CDAPP, so this is a great opportunity to see that. The Memorandum of Understanding provides the basic tenets necessary to remain and receive the benefits of being an affiliate. What are those benefits? Those include receiving printed education materials made available at cost, free continuing education credits for registered nurses and dietitians, referral listings on the affiliate referral locator website, which I'm going to demonstrate in a moment, and maybe most importantly, knowing that your patient outcomes will be based on the performance-proven standards of care. For those clinics that complete the requirements, the Resource Center will also provide a certificate suitable for framing that can be hung in your clinic, identifying you as an affiliate CDAPP Suite Success Program provider. Highlighted here, the first of the tenets is to ensure that all affiliate staff who provide diabetes care are trained in the care of women with diabetes. That patient care is provided by healthcare providers who are knowledgeable in the guidelines for care and incorporate these guidelines in their current practices. That would be the second tenet. And then we also ask that the affiliate completes an online annual survey, which we will look at in a moment. And that's a very simple form. And of course the education requirements that I discussed, that your clinic staff participate in the educational courses to keep up to date with current diabetes care practices and information. The Memorandum of Understanding can be signed and sent to me electronically as a scanned image, by fax, or by regular mail. I will sign and return a copy to you and maintain an electronic record copy here in our office. We've already received many of these, and we'll start signing those and getting them out to you next week. The Affiliate Online Annual Survey looks like this, and it's a very simple one-page form. It's completed each January. It just has your basic clinic information and client population, and here I've highlighted the basic information portion, and then at the lower area I've highlighted the information regarding the numbers of diagnosis of your clientele. This information is collected so that the Maternal, Child, and Adolescent Health Program can track the trends and numbers of patients being cared for through the CDAPP Sweet Success program in California. Of course, this form wouldn't be used outside the state, but for those that are affiliates within the state. I'd like to take a moment and just point out the state website. It will remain open until our website is completely fully functioning and that people are aware of the existence of our new website. And I'm just going to click on one of the areas here. Notice under New Hot Topics and Updates, I want folks to know that the MyPlate Diabetes, this can be downloaded from the website and printed in your office. Of course, if you want color prints or tablets of color prints, we can do that for you. Send that as an order to us. And then I wanted you to know about these newsletters. You can stay up to date. These will be transferred to our website prior to the closure of the state website. But know that these exist, and there is some great information. The closure of the CDAPP regional offices was noted in this 2012 Volume 10 issue. And then over in the right lower side, you'll see professional information, and we wanted to just highlight that you can download a catalog for ordering, which has with it at the end all the materials that you can order, as well as the order form that can be faxed to us. And lastly, I'd like to note that the diagnostic criteria algorithm is also available, and that's the first one on that list. So I just wanted to give that one's taking a moment to load. I just wanted to give a brief review of this state website. I don't know why that one's taking, it loaded just fine just before, so I'm not going to take up your time, but know that it's there and downloadable and that you can print those. In addition to, whoops, my apologies. In addition to the state website, we are building a website that is cdappsweetsuccess.org, and I said I'd demonstrate the affiliate locator. So you may be a midwife or a practitioner that has discovered your client has diabetes, and you won't know where to send them. We're down here in San Diego, so if you type in your zip code where your patient lives, where you'd like to send them for an affiliate, you put your zip code in, and there within, I did within a 20-mile radius, but you can refine your search if you wanted to just go 10. Then the map gets a little bit larger, and just those in the immediate vicinity. So you can refer them to a Sweet Success affiliate. And these are all over the state, and there are well over 100 already added into the system affiliates that are confirmed and remain affiliates of the program. And I think I can close that. I keep doing that. In addition to that, we want folks to know that they can use the logo in their promotional materials. We get requests now and then that you're having an event or you have information that you want to send to patients identifying your clinic information. You can apply using a form that's also downloadable from the website. Once you've filled it out and send it back along with the brochure that you're going to use it on, we'll look at that and give you a very quick turnaround on the approval. So we do encourage you to use it in a promotional and appropriate fashion. Here's our